Well, hello again, everybody. Welcome into another Keep Boone Healthy Information Channel video spectacular. I am David Jackson, president of the Boone Area Chamber of Commerce. Great to have you with us here on this dreary Thursday. We have seen some exciting news today in the vaccine realm. As we have anticipated at times, we've seen the timeline move yet again in a positive direction for those that are still seeking COVID vaccine. And we'll have plenty more in this email to read about those changes here as you click below. But for right now, stay focused here because we do want to continue to talk to you about the vaccine process and give good information about anything that may be lurking in your mind about your desire, your hesitancy, perhaps, to get that COVID-19 vaccination, especially as we're moving into new groups, a new group of essential workers here very soon, the general public here very soon as well. We want to make sure that this information is top of mind. So we have gathered another group of our medical experts here in the community. Of course, Jen Greene, no stranger to anyone, Director of Public Health for AppHealthCare. We have Dr. Scott St.Clair from Blue Ridge Pediatric and Adolescent Medicine with us, and a new face to the mix here. So pleased to have Dr. Beverly Womack with Harmony Center for Women here today, part of the Appalachian Regional Healthcare System. Great to have you and your expertise on the call here today as well. So Jen, let's first start on kind of where we are. Vaccine schedules have been ever changing. One of the constants of COVID is that everything has changed at some point in time. So we have seen, though, more positive change in the direction of being able to vaccinate more people here over the last few weeks. What can you tell us about how that's counterbalanced with availability of vaccine and overall operations to get people shots here in Watauga County?
Well, I'm really proud of the effort of all the vaccinating providers. I think, really our goal has been to vaccinate as many people as we can, as quickly as we can, and we are certainly on our way. I'm happy to say we're into group 4, and really next week we'll be moving into essential workers that haven't previously been vaccinated. And we're just sort of at the point now where we're ready to move forward. So I would encourage anyone who is interested in a vaccine to reach out. We've got a lot of vaccinating providers who are ready to start giving you your shot.
So with that, as people that may have been in the back end of group 4 or even into group 5, and they thought, I've got some time before I need to make this decision. Maybe that decision-making time is coming back around a little bit faster than anticipated. So with that comes the need for information. And that's where our local medical providers have been so helpful during this process to help, again, identify what people's questions are and give them good quality, scientifically found answers to those questions. So Dr. St.Clair, I'll start with you because you see well, both of you really see the whole family in various stages, but you have been one of the advocates for getting good information and making quality decisions from the start with this, and we appreciate your voice in this process. What kind of questions are you hearing from families at this point in time, and on from kids that may be eligible for vaccine onto the adults that bring them in about the questions that they have and the hangups potentially that they may have about the process?
Yeah, I think some of that's probably going to get better with some of the stuff Jen said, because a lot of the confusions around what group am I in, when can I get in, and all that kind of stuff. So as we're moving into phase 4, the end of phase 4, and hopefully phase 5 soon, some of that confusion will go away, and it's less going to be about when is it appropriate for me to get it. And it's like everybody's numbers up, and I would just encourage anybody when their time is up to just get the vaccine. I think in terms of questions that we've been getting from people, probably, I think when it comes down to most people about vaccines or really any medical decision is like, is it safe and is it worth doing? And I think on the is it worth doing, I know we've talked about this before on these other ones, but the vaccine effectiveness is really, really high. So regardless of your vaccine, Pfizer, Moderna, Johnson & Johnson, your risk of dying or ending up in the hospital is basically about 0% after you get fully vaccinated. So it's highly effective that way. It's effective in keeping you from getting sick at all, and it's effective keeping you from transmitting it to others. So it's protecting you, it's protecting your family, it's protecting all the rest of us who live in this community. So in terms of the benefits, does it work? It's pretty clear, and every data point that's come in from the original trials shows that it's really effective. I think on the hesitation side, probably the biggest question I hear is, was this done too fast? Was this done in a rushed way? And I think the thing that people need to know is that, number one, none of the steps in the process were skipped. So phase 1 trials, phase 2 trials, phase 3 trials all happened like they would have for anything that had to get passed. Large scale studies, each of these studies had about 40,000 people, 30 to 40,000 people. And they've been shown to be safe. I think the reason that things happen so quickly, and I think that's important for people to understand, is that the technologies that are doing this have been sort of working for the last 20 years, really building to this moment, so that when this crisis came, some of this technology that we had not previously had been building and building and building. So the technology did not come out of anywhere. It had been 20 years of work on it. And then the federal government invests a large amount of money. And so these companies had the ability to really step out and push the bounds, not worried about the financial impact, and could really just develop the science part of it. And then when these vaccines got rolled out, they got rolled out at a time when there was a ton of disease. And so the studies were able to finish up much quicker, just because lots of people were getting sick in the placebo groups. So they were able to finish up. So I think that's important for people to know, that no steps were skipped, and that there were several factors came together to really allow this to happen so quickly. But that's probably the most common question I'm getting in the office, is just about the speed. So I hope that's helpful for people, and happy to take follow-up question about that.
Sure. Well, and your office is certainly probably leads the area in providing vaccines, obviously at different ages and for different reasons. But you all have studied this stuff so well over time. Just hearing your comments there, hopefully will sit well with folks. Dr. Womack, another major part of this conversation has been how vaccine impacts different groups of people, whether that was elderly when we were first talking about that, people with different medical conditions. We've just gotten into that, but the impact on women's health has always been a very forefront part of this conversation as well. What can you tell us about some of the science that you have read, and the way that you are communicating with your patients that have questions varying from dealing with a pregnancy and wanting to get a shot, dealing with some of the fertility questions that we've heard about, and some of the other things that may be forefront right now as part of this conversation?
Sure. So every day I talk with patients about the impact on fertility, the impact on pregnancy, and the impact with breastfeeding. At the beginning of the COVID epidemic, I feel like we initially thought, well, pregnant ladies and babies aren't really being affected, so we can kind of not worry. Let's not even consider vaccination for pregnant women, because pregnant women aren't being affected by COVID. That has been totally shown to be false. So COVID can harm a pregnant woman. It can harm a child or a newborn. Pregnant ladies are just as at risk for complications from COVID as a non-pregnant person. Pregnancy in and of itself makes all women want to be very certain of what they're putting into their body. At Harmony, we have a process that we go through with each individual pregnant woman. We have a checklist that she can fill out to look at her risk and her benefits of vaccination, timing of where she is in pregnancy. But what we've seen from all the data, as more and more people around the world are being vaccinated, and some of those women are pregnant and don't know it, or pregnant and comfortable with the risk-benefit ratio, that we are not seeing complications from the COVID vaccine in pregnancy. We are not seeing adverse outcomes in their babies. Their babies are being born just as healthy as unvaccinated women, and we continue to see pregnant women who do suffer from significant illness and hospitalization if they do come into contact during pregnancy. Very few concerns with breastfeeding ladies as well. And I think one of the biggest conundrums in our country right now does center around fertility. At some point in the social media world, a message got sent out that, gosh, this can enter your DNA, it can affect your fertility. All of that information is scientifically inaccurate. The vaccine does not change our DNA. The vaccine does not affect fertility. In our country alone, we've had over 100 million vaccine doses given. We've not seen any impact on fertility. So even for my patients' younger children that are eligible for the vaccine, 16, 17, I am an enthusiastic supporter. Vaccination is what's going to get us back to being able to hug each other and love each other and come together.
You know, we were talking a moment ago, Dr. Womack, about a couple of things. One, that you know, and you mentioned it just a second ago, that at the beginning of COVID, there were some things thought to be true, and science has helped bear out whether that is true, or maybe something was assumed to be true and now is false, based on having some time and having some space to study these things. Can you maybe, and both of you potentially here, comment on the way that this whole phenomenon has allowed people to see that things do change, patterns do change, or with more opportunity to study comes new advances, new outcomes, and how that you know works into the way that you're able to communicate and provide the trusted opinion that you can to your patients. I feel like there's something to be said for having a conversation with your doctor, and then having a conversation with your doctor 6 months later, and they say, you know what, we've learned some new things, and let me give you some additional information to consider. Have you been able to see positive gains made in your relationships with your patients and your ability to communicate because things continue to come into a greater light now?
Absolutely. And that's what, you know, I tell all of my patients, even patients I may be seeing for the first time and may not have had a chance to really develop a relationship with, find a medical professional that you have a trusted relationship with and ask them their thoughts on what they know and the information that they've gathered. All of our authoritative bodies, like I am a member of American College of OBGYN, Dr. St.Clair, American Academy of Pediatrics. These organizations are doing such a wonderful job of taking information from studies, from experiences around the world, and sending them to providers in real time. So it's daily that I get information about COVID vaccination, pregnancy, breastfeeding, fertility. All of these things come back to me on a daily basis. We're all heavily invested. So we want to know this information, and we are all willing to share it with all of our patients. And it doesn't necessarily have to be the very scientific, confusing language. We're all trained to interpret that data and to explain it to people in language that should be easy to understand. But I would say use somebody that you trust. Ask them what they would provide for their family and what they did for themselves. But we have that knowledge that you have to be able to understand in context and not just read on Google or Twitter. It makes a huge difference. And it is very individual. There may be some patients that I say, gosh, maybe we should wait for a little while, or maybe we should consider other avenues. But I think that's a very individualized approach, and especially in pregnancy, it's worth having those conversations and concerns with people. Two, you can impact other people in that patient's family. So while you may not choose to be vaccinated, let's see how we can get your husband, your mother, your father, and your sister vaccinated. So it's important to have those conversations with somebody you trust.
Dr. St.Clair, anything you want to follow up on with that?
No, I think that's all great. I think just tapping back into what Beverly was talking about with the fertility issues. I'm in a different part of medicine than Beverly, but I've got a lot of young women and moms in our office, and this question has come up. And so I just do think it's important to emphasize that, as what Beverly said, there's no evidence of fertility. And in fact, I can link this to you, David, but one of my trusted sources of news is Dr. Paul Offit. He's at the Children's Hospital of Philadelphia. And I'm trying to help parents get good information. I've actually found a nice 2-minute clip from him talking about it. And I think one of the important things that he mentions there is we've looked at women who've had COVID itself, and there's no evidence that someone who's had COVID or having any fertility issues. And there's really no evidence in prior diseases where someone who actually had the disease, the vaccine is obviously less stressful for the immune system than the disease is. And so no evidence from women who've had COVID that that's affecting fertility. So maybe we could throw that into the notes with the show, but I think that is important. but I do think the things have shifted and changed. I mean, if you think back to this time last year, I know we certainly were cleaning all our groceries when they came in the house, right? And so we thought that may be a way that you're going to get COVID, but that turned out not to be. And even with the school situation, that there's been good data that's been much talked about recently about 3 feet versus 6 feet in schools. And these things it takes time to study them, do some rigorous study and find out what is best practices. But those are sort of two things that come to mind that things have shifted as we've talked, and the school thing has been clearly on the minds as schools changing.
Sure. And I think that there are people out there that are scorekeepers too. And I think it's important to note that doesn't necessarily mean that initial guidance was bad or wrong. It's just, like you just said, you've had an opportunity to study that further, and it's given you better information or more nuanced information that can help make those decisions a little bit easier. Let me ask one more question for the doctors. And then Jen, I want to follow up with you on a couple more things real quick too. People have a heightened sense of anxiety right now. I think that could be the understatement of the week. And with that comes the need to find whatever the information is. And so there is the group that, I've got a pain, I'll get on WebMD, and all of a sudden I've got 12 different things that can be, and none of them are easy. So maybe your advice about trusted sources, if people want to read more about some of these things and want to get good factual information and not be led down rabbit holes that could make that anxiety and that feeling of, I just don't feel good enough to do anything right now. Maybe something to alleviate some of that. Either one of you can take that one first.
Yeah. Oh. Yeah. I mean, first off, the first thing I'll say this delicately, but please stay off social media when you're trying to get any vaccine related information. And almost every conversation I've had with some misinformation has usually involved social media as a source. So the CDC is really good, but I always point people, regardless of the vaccine. The Children's Hospital of Philadelphia has put a lot of effort and money into a parent site about vaccines in general. And they give a lot of really good, understandable information and let you dive deeper if you want to. So if you were going to go to a place and get information, I tell people put in CHOP and vaccines. And again, we can link that in the notes, David, but that's a really good source for parents to go and adults to find out about vaccines. And they have a whole section now on COVID vaccine. And so that would be a place I always direct people to, in addition to the CDC.
Great. Fantastic resource. Dr. Womack?
American College of OBGYN is acog.org. Has great links, easy to understand information, all referenced if you do want to get deep in the weeds of the scientific data, as well as the National Institutes of Health, NIH.gov. And then Johns Hopkins has phenomenal information about COVID, and that's a independent, well-respected medical organization for people who want to get away from government-linked sites. They all have fantastic information, and I do encourage my patients, because they're going to get on TikTok and get videos from Uncle Joe. Bring it to your doctor. If it makes sense and it scares you, bring it to your doctor and say, why is this wrong? What is wrong with this? Correct this information for me. Or is the information correct and do I need to be worried? We're happy to go through that information with you. We should all be able to explain it, and then you can go and explain it to your friends.
Well, and no disrespect to anybody's sister's, brother's, boyfriend's, cousin's friend who happens to work for one of the agencies that we just discussed. I think it is also helpful to know that however you make your decision, whether you are for getting vaccinated, don't want to get vaccinated, making that decision off sound medical advice is certainly something that we're hopeful that everybody is able to do with the resources that our medical experts here have provided, and a few others that we have talked about throughout the process. And you're making your decision off the right information, not speculation or social media fodder. So important point to make for sure. Jen, as we kind of wrap this up, we have seen a lot of guidance locally, both doctors referenced the schools and some of the changes there that we've seen, but whether it's the governor's order that came out this week, vaccine protocols, with all of that, what have you and the health department staff, I know the hospital's done this too, done to kind of make sure that everybody is able to follow along with local change, keeping that within the context of Watauga County and how we're operating there?
So we're just trying to make sure we're a good resource. We still have a call center that is staffed 6 days a week. And we're here to answer questions and point you to some of these more credible sources of information. We've certainly been working very closely with our schools as they are, working through bringing more kids back more days in the week. And we're excited about that. Just to remind folks, we're not stepping away. We still have a very close relationship with the school nurses, and they do a great job keeping us informed. So we're still monitoring everything that's going on, but we have great confidence that we're at a good place. And it's so good to see in 2021 that we're talking about something positive, like vaccines and solutions, like kids going back to school more that, in comparison to where we were a year ago. So just to give me another chance, David, I really appreciate everyone who's willing to dig into the information, ask the questions, and really consider getting vaccinated and helping your friends and family have good information to inform themselves, because it is really what's going to help us get to the other side.
One last question too, and I feel like this is maybe gotten pushed aside a little bit with the conversation about vaccine being so prevalent, but for those that still need the testing element, that aren't in a place where that's readily available, like a school or maybe a workplace that's doing testing, what are some of the resources that you could remind people about if they need to get that COVID test and feel like that's a level that they need to get to for, again, lowering anxiety about a potential exposure?
Yeah, sure. Well, I think your healthcare provider is a good resource. I also think, Boone Drug is still offering testing. AppHealthCare, we still offer testing. And you can go to our website, apphealthcare.com. You can call our call center. That's 828-795-1970. And we can help you identify where you could be tested. And I think too, just being aware, it's important that we are seeing hope and that we're excited, and that we don't forget that it's still important when we're in public settings. We're still wearing masks. We're still trying to keep our physical distance and looking out for signs and symptoms of illness and having that conversation with our healthcare providers if we're concerned.
Well, folks, this has been wonderful information. I thank you all for your time. I know your schedules are very busy, and certainly on behalf of our entire community, we thank you all for every role that you are playing individually and collectively to help keep our community healthy during this time. It's amazing to think that we have been at this for more than a year now, but I think some good has come from this, and reminding folks that your local trusted medical provider is still the greatest source of information for you. They know your body, they know your specific situation. They can help you make those specific decisions. And we certainly appreciate having a couple of you on here today. And Jen, your wisdom as always. And we look forward to talking to you about more positive news here as we go forward here in this together. So thank you very much again for your time.
Thank you.
Thanks, David.